Hi friends, welcome to classes by Lab Doctor. In today's class, let us just see what is angiogram very briefly. I'm talking about angiogram because angiogram has become very common nowadays. जैसा एक blood test है वैसा अभी angiogram हो रहा है क्योंकि every third or fourth patient is having heart issues because of our lifestyle, our eating patterns, sedentary life, the chances of getting an heart blockage, etc., is more. And to know whether there is an heart blockage, etc., we do this test called as angiogram. So, as a student, you have to have a brief idea what is this angiogram. अगर कोई आपका रिलेटिव पूछ लेता है कि ये एंजियोग्राम क्या है, कैसा करते हैं, एंजियोग्राम के पहले हमको क्या क्या करना चाहिए, व्हाट प्रिकॉशंस वी हैव टू टेक आफ्टर डूइंग द एंजियोग्राम, एटलीस्ट आपको एक आइडिया होना चाहिए कि व्हाट इज दिस एंजियोग्राम, इसमें करते क्या है एंड व्हाट यू हैव टू एडवाइज द patient. So let us have a brief idea about what is this angiogram. So, this angiogram is a minimally invasive procedure which identifies or confirms that an artery and a vein has an abnormality or a blockage or a narrowing or an abnormal connections. So, basically, this angio means blood vessel. It could be an artery, it could be a vein, and gram is the study of the blood vessels. So, हम इस पे क्या स्टडी करते हैं? We study how is this artery, how is this vein? Is there any blockage? Has the artery become narrowed, or is there any abnormal connection? Is there any kind of an aneurysm? So all this we can make out when we study this artery or the vein. So angio is any blood vessel and gram is we take multiple x-rays and we find out what is the abnormalities in the arteries or the veins. So this study of this vessels, blood vessels, is called as angiogram. So now this is a very minimally invasive procedure. So here we are not cutting open the vessels or we are not cutting open any part of the body. Very minimally through just a needle insertion in one of the blood vessels, we reach the vessel, and through injecting some special dyes we take multiple x-ray and find out. So this is a minimally invasive procedure, and the study of this is called as angiogram. So this is done after injecting a liquid contrast. So the term angiogram refers to the number of diagnostics tests which the doctors use to find out a blocked or a narrow blood vessels. So not that angiogram is only done for the blood vessels of the heart. It can be done on the blood vessels of various parts of the body. So when we for especially we do this for heart disease, and when we say angiogram, people only think of heart. So here you can have whenever we do an angiogram, it need not just mean the heart. So we also do it for the other organs also. So for the brain we do it to see if there is any risk of stroke or etc. We can do it on the chest or the lungs to detect if there is any abnormal bleeding. We do it in kidneys to look for high pressure in the renal blood vessels. We do in the reproductive system when we have to do the embolization of the tubes, or when we have to do the embolization of the fibroids, or we do it in the legs, etc., whenever there is a trauma, whenever there is an injury to the arms, to the eye, or any other part of the body, to detect if there is any tear, etc., if there is any bleeding, we can do this angiogram. Sometimes we do it in the liver to see if there is a person has a cancer. So we can do this angiogram. We can study the blood vessel in any part of the body. It's called, all are called as angiogram. Now that we know that this process is mainly used for the heart, we connect this with the blood vessels of the heart to see there is any blockage, narrowing, etc. But angiogram can be done on blood vessels of any part of the body, from eye, liver, lung, uterus, etc. So this you can see that this we will be mainly talking today about the catheter angiograms of the heart, so the heart vessel study. So this I have told you that this angiogram is a type of x-ray which we use to study the heart blood vessels. So what happens is, when we take an x-ray, the blood vessels don't show very clearly on the ordinary x-ray, so we have to inject a special dye through which we examine these blood vessels. So this dye, when we put this color, you can see here this contrast color here, this will move inside the blood vessels and it will highlight, so we can find out if there is any kind of a blockage or if there is any kind of a bulge, etc. So the medical name for this is catheter angiogram, because we pass a catheter here and we study the blood vessel, we take x-ray. This is called as catheter angiograms. So sometimes we also carry out angiogram through by using MRIs, by using CT. So that facility is also available nowadays. CT angiogram, MRI angiogram, etc. This, when we take X-rays and through the contrast dye, that process is called as the catheter angiogram. The heart, and you can see that these are the coronary arteries. So these coronary arteries are nothing but these are the special blood vessels which continuously supply the heart with oxygen rich blood, and these are very important because they have to see that the heart keeps on pumping blood. So this coronary artery becomes very important. So when there is blockage in the coronary artery, when there is narrowing, when there is occlusion in the coronary artery, that can cause various complications, and we try and find out the blockage in these coronary arteries through this angiogram. So here you can see this is the cut section of the heart, and these are the chambers of the heart, and these are the valves which allow the blood to flow in a particular direction. They control the blood flow. So I have told you that there are various other methods also, like you have echo, which will help us to see how is the blood flow. We can, through stress test like stress TMT, we can see any changes in the ECG which will indicate there could be a blockage, etc. But angiogram, or that is the only 100% where we can find out there is actually a block. There are transesophageal echogram, there are CT, MRI also, which also helps us to find out if there is any kind of a blockage. So why do we do an angiogram, or why does the doctor order this angiogram? So the doctor will order this angiogram if the patient has any symptoms of a coronary artery disease. Coronary is the arteries or the blood vessels which supply the heart. So if there is any disease of those blood vessels, then the patient will get certain symptoms. Like I've told you, the patient can get angina, he can have pain in his chest. This can be a pain which he might feel like a tightness. He might start sweating. The pain might radiate to his back, to his shoulder, to his jaws, to his ears. He might feel something very heavy lying on his chest. There might be difficulty breathing. The patient might just collapse. So these are all the symptoms of angina. So whenever the patient is having such symptoms, whenever the patient shows such symptoms, doctor order a angiogram, because they will suspect if there is any blockage in these coronary blood vessels, because of which the heart is not getting enough oxygen. So whenever there is some kind of a stress, the patient has exerted, patient was angry, and the requirement of oxygen became more, but it was not getting because the coronary arteries could have been narrowed. To suspect and to see if there is a narrowing, we do what is called as an angiogram. Suppose if the patient has got a new detected chest pain, or there is a chest pain which is increasing, then also the doctor will advise an angiogram. Suppose if the doctors are suspecting any congenital heart disease, he can order an angiogram. So suppose the doctor has ordered, a stress TMT, or the doctor has ordered an echo, and therein where the doctor has felt that there is some abnormal results which could be because of a blockage, that time also we confirm it only by doing an angiogram. See, ECG or echo, they won't tell you that you have a block. They only tell you when the muscle is damaged. If there's a heart attack, yes, we can make out that there is a heart attack, there is an MI. But to see there is, if there is any block and how much is the block, we need angiogram. So suppose if there is any other blood vessel problems or a chest injury, or there is an heart wall problem that requires a surgery, pulmonary embolism, or if there is blood clots in the lungs, etc., we can go and do an angiogram. So I've told you, see here, you can see that this is the blood vessel, this is ballooned out and this is bleeding. So this we can find out with the help of an angiogram. Here you can see the artery here which is narrowed so much, and the blood supply, or there is a very poor blood flow. So you can see here the very less blood flow, or the occlusion of this blood vessels, which we can make out with the help of this angiogram. So here suppose if there was an occlusion and the blood flow was very low, and there was when you see the blockage, the doctor immediately through the same process he can repair it. That is called as angioplasty. So the best part about this angiogram is whenever the doctor gains access into the blood vessels and उनको अगर लगता है कि ये ब्लॉक हो गया है, इसको ब्लॉक को हमको ठीक करना है, उसी समय डॉक्टर यहाँ पे स्टेंट प्लेस कर सकते हैं. स्टेंट प्लेसमेंट उसी टाइम हो सकता है. सो ये एंजियोग्राम के साथ वो एंजियोप्लास्टी, प्लास्टी मतलब रिपेयर, तो वो एंजियोप्लास्टी भी कर सकते हैं. पेशेंट आया, उसको हार्ट अटैक हुआ था, इन्होंने एंजियोग्राम किया, उसमें ब्लॉक दिखा, इमीडिएटली डॉक्टर्स वहां पे स्टेंट लगा देंगे. That is called as an angioplasty. So angiogram is one procedure wherein the doctor can do emergency angioplasty. Angio means blood vessel, plasty is repair. We can repair the blood vessel that time only. Suppose when the doctor does an angiogram, he feels that there is a blockage and we can repair it. He will do this angioplasty or stent placement. So he will place a tent and he will place a stent and see that he maintains the blood flow. So that is the beauty of this angiogram. Here you can see this is the coronary artery. They have placed a catheter here, so they will see which vessel is involved. They will take multiple x-rays with the help of the dye. They will see where is the blockage, and if necessary they will even place a stent. So this you can see the catheter they have inserted here. Here they have used the wrist vessels, and they have moved the catheter and they have reached to the heart blood vessels. And in the blood vessels they are seeing that, see, you can see that there is the blood flow is narrowed here, and the diagnosis of occlusion is made. This was about angiogram. What is it, when is it done, and how is it useful? In the next class we will see what is the procedure of this angiogram. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.